Hi, my name is Clarabelle. Welcome back. I've been sharing most recent stories on my journey with my Crohn's, which is a big part of my channel, health and wellness, and speaking about how I've had some complications with my Crohn's and having strictures and adhesions. As I've been editing some of my current surgery recovery videos, I realized that I skipped a big part of the story, the hospitalization that actually led me to having surgery scheduled. If you watched my last video, it was a get ready with me and a talk through about my recovery after a third sigmoidoscopy that I had. In that video, I kept saying that something was off. I didn't feel the same. That was my third sigmoidoscopy at the same hospital. The two that I had previous within a year and a half were very different. I felt immediate relief. I felt better. If anyone out there has Crohn's disease or just have had any strictures, it is excruciatingly painful and debilitating. It gets to the point that you can't eat. And if you get hospitalized, you get basically you get a tube down your nose pumping your stomach for a couple of days. And you have to be NPO, which is eating nothing for several days. That has been my story for the past 5 years. It's been painful, excruciating, but you know what? I don't complain too much about it because I've had Crohn's for many years and this is part of my journey. I'm a pretty positive person for the most part, and I try to stay that way. I just try to learn and move forward. With that said, in that video, I mentioned how different I felt. And things just were not right in comparison to the previous two. I felt as if I had another blockage, which is, again, part of the stricture feeling. And I, I just knew it was off. And I even had called my doctor and told them that I wasn't feeling right. Look, my body knew. If you've seen any of my videos, then you know I say a lot. You have to advocate for yourself. And that I swear I probably need to put that on a t-shirt somewhere because I truly believe that we fail sometimes to advocate for ourselves, whether it be in healthcare, at work, anywhere, at home. You have to stand up for yourself and you know your body. So I knew something was wrong and I was just trying to push through it. But then a couple of days later, what ended up happening was I couldn't push through it anymore. The pain was real. And by the 12th of January, I had to go to the hospital. I was profusely throwing up, abdominal pain. And so here I am thinking I'm going to have a third sigmoidoscopy. And the reason why my GI team has always pushed for having a sigmoidoscopy as opposed to immediate surgery, which has always been on the table, is because I've had so many resections, intestinal resections in the past. I've had 7, well, 8 to date today, but 7 at that moment. I've had over 10 surgeries as a whole, but 7 of those being resections. And so they were trying to prolong, if you will, me from having another surgery. The last major resection that I had was 10 years ago. Again, that's why the sigmoidoscopy exists. It's like a colonoscopy, as I've mentioned in my previous 2 videos, but what they do is they balloon the areas that have the adhesion and strictures. They have to be careful with me because if you balloon those areas to stretch out the stricture of your intestines a little bit so food can pass and you don't have a blockage, sometimes that can cause more issues if they were to balloon it too much. So this was kind of going to be the third one and no more kind of thing, 3 times the charm. They had done, like I said, 2 prior in a year and a half, and this was going to be my third one. And hopefully that was going to last for another 6 months or 8 months, we were hoping for, before we have the surgery discussion. So there's that brief backstory. Well, nonetheless, I ended up in the hospital on the 12th, profusely throwing up, abdominal pain, on my knees. If you know, you know. If you don't, I don't want you to know. I really don't. It's awful. Um, I was immediately hospitalized, and I knew immediately the discussion that I was going to have with my GI, and that was surgery. At that point, I'll be very honest, I was all in. Prior to that, every time we've talked about it and spoke about the potential of having surgeries, I even had it scheduled 2 years ago. But I believe everything happens for a reason. I've spoken about this in previous videos, how the past 2.5, 3 years have been even more difficult because my mom was sick and she was getting worse. I was sick and I was getting worse with my strictures and pain. And on top of that, I was going through menopause and changes in my body that I just didn't quite understand, but also not taking the time to understand because I'm dealing with my issues and I'm dealing with family and trying to help mom. Well, the August before mom died, I had surgery scheduled, but I found out that if I had surgery, I had no way of bringing income, and it was going to really just be more of a stressor in our family. So I said, you know what, let's hold off. And then that's when we decided to do my second sigmoidoscopy. Well, lo and behold, not but a month later, my mom passed away in September. So I think that was God. Um, because had I had surgery, I don't know how I would have been able to handle my mom's death. Um, Even though she was ill, death is death and it's permanent. And it was hard. So I think everything happened for a reason, and we were able to postpone surgery. And then for the next year, I started figuring out this grief and how life really changes in midlife when your parent dies or parents. I don't have a mom now and I don't have a dad. So life really changes with grief. And so the next year, I really just tried to recover with Crohn's and get better and start living life with grief and trying to figure out how life is lived after a parent or a loved one dies. So, a lot of changes with that. But that didn't stop me from being hospitalized. I was hospitalized 2 more times in between that with strictures. And that led me to being hospitalized after my third sigmoidoscopy in January of 2026. That is why I was ready to say yes to surgery. I just knew. Mid-January, I was like, okay, when they come in, the surgeon, we're having that discussion. And sure enough, immediately we did. So we scheduled the surgery for April. I was determined. I was ready, mentally ready, as much as I could be ready, with questions in mind already. But I was ready to say yes to surgery. So when GI and the surgeons all scheduled their appointments after I was discharged, I was in the hospital for about 6 days. NG tube and all, the tube that goes down your nose into your stomach. It's horrible. Pumping your stomach out for days, not eating. And was sent home and then had my follow up appointments. And I was able to schedule surgery for April 9th. And then the next few weeks after that was prep time for surgery, mentally, physically, household family support who's going to come and help me. Because abdominal surgery for Crohn's, it's not easy, or at least it isn't for me. And the fact that now I'm 50, I was prepared that things were going to be much different than when I had my last major surgery when I was 40, 10 years ago. Right. So that is where the major story that I missed in the timeline of my videos. It's how I got from the sigmoidoscopy to having surgery and now recovering. So with the surgery itself, I now have been 5 weeks recovery, and it has been a crazy one. I've been hospitalized one time since my surgery because of complications. And it's more so because I have an ileostomy bag and I'm having dehydration issues and kidney issues. And so that's been part of my recovery process. The surgeon removed a foot of intestines um, with the strictures and reconnected those intestines back. But I have an ostomy, an ileostomy to be specific, and that's to help my surgery sites heal inside. I have really great moments in the day where I have energy, like right now, but then those are only moments. This is only a moment of my full day, and that is spent in bed. I have to bring a bed into my office because change of scenery. I'm tired of laying in my bedroom. You got to do what you got to do when you're recovering. That's what's happened since January. I am so in tune with my body. It's crazy. And I don't know if it's because I've had Crohn's for over 26 years, or it's part of my personality, or maybe both. Who knows? But I'm very grateful and thankful to God that I am, because now the next video I'll be posting is about my complications that I'm having. But at least this gives you an in-between understanding of what's happened since my sigmoidoscopy in January. And then the next videos you'll be seeing on my recovery. That is the story as of right now. The story with my Crohn's continues. It's mine forever. It's not going away. I have suffered for a long time, but I've had good times as well, and I have good moments, and I really try to capture those moments that I feel better, especially now during recovery, and take advantage of that and share my story. I don't share my story so that people can feel bad at me or bad for me or get the woe is me or even to get attention. I've been very transparent all of my life with my Crohn's. I'm not embarrassed about my disease. I am very adamant about speaking your truth and speaking what your life is like with a disease, how debilitating it can be to relationships, for work. That's a story in itself. There's so much disruption, but there's beauty in that too, because I have learned so much. And if I can share my story and help you, maybe just look forward to the positive, maybe see things in a different light, and maybe see that this is reality for so many people. That reality on Instagram and Facebook or whatever you use, those moments, those snapshots are just moments of somebody's life on the beach or whatever. But this is real life, right? Every day having ups and downs. I get off on a tangent real easily. This is where my story left off from my last video. And this is where it's going to pick up for my next. This is what it looks like for me: ups, downs, in betweens, good, bad, ugly, pretty sometimes, not so pretty some other times. If you have any questions about Crohn's, about inflammatory disease, please let me know. I encourage you to join an advocacy group if you do have Crohn's and you need support. I'll put some links at the bottom below in the description box. I have my email below too. Just shoot me a message. I'm always happy to help and happy to clarify anything, especially if you're going through something similar. You're not alone. You're never alone. Trust me. And I hope you're having a good one, and I'll see you next time.